So Emily came in here today with neck pain, trap pain, right SI pain. One of the things that really makes us different is we have 3 different people working on her today, doing trigger point injections for her right SI joint as well as her trap to help release those knots in her muscles. So whenever she comes out for physical therapy, it helps her perform the movements better. There we go. Feel it?
Yeah.
Okay.
I'm having Emily rest her hips evenly on the table, making sure the right and left hip is perfectly even. Using the table as a guide and a level, Emily's making her left leg short, right leg long. We get away from doing these movements in the gym because it's funny. It looks funny, right? But it becomes a dead zone. And with that, when we fall into these positions, it's an injury. So this is a good way to gently re-educate that area. Educating the curve back into the low back.